The role of sentinel lymph node mapping in endometrial cancer has been an interesting area of research over the last several years. Based on data in breast cancer, vulvar cancer, and melanoma, the role of sentinel lymph node mapping, once identified, can hopefully replace a full lymphadenectomy in patients with high-risk disease. Based on this information, we wanted to design a prospective validation study to really identify the false negative rate of sentinel lymph node biopsy in endometrial cancer. In order to do this, we wanted to pick a high-risk population with a node positive rate of about 25%. We also wanted to make sure that a comprehensive surgical staging was performed, so we really knew the true false negative rate. And we wanted to use a technique that we felt was generalizable to different types of gynecologic oncology practices. Based on that information, we completed a prospective single-arm study evaluating the false negative rate of sentinel lymph node biopsy in women with high-risk endometrial cancer. Women were considered eligible if they had a high-risk histology, including a grade 3 tumor, serous, clear cell, or carcinosarcoma. Patients were also considered if they had deep invasion on preoperative imaging or proven cervical involvement. Once patients were enrolled in the study, they underwent a preoperative PET-CT to evaluate for any metastatic peritoneal disease. If they had no evidence of disease, they went on to surgery, at which time they had an intraoperative sentinel lymph node biopsy, followed by a hysterectomy, BSO, and a full staging procedure with periodic lymph nodes taken up to the renal vessels. We then compared the sentinel lymph node biopsy findings to the final pathology. Overall, we enrolled 101 evaluable patients to complete this study. The sentinel lymph node detection rate was about 90%, with 58% of patients having bilateral sentinel lymph nodes found. In the overall group, the node positivity rate was 23%, and of those 23 node positive patients, 3 patients did not have a sentinel lymph node identified at the time of surgery. Among those that did, 19 out of the 20, or 95%, had a positive sentinel lymph node for a sensitivity of 95%. There was 1 patient who mapped to both sides of the pelvis and had negative sentinel nodes, but had a non-sentinel lymph node that was positive, so 1 true false negative. Based on this data, we identified that the false negative rate of sentinel lymph node biopsy alone is 4.3% in patients with high-risk endometrial cancer. In addition, if you have a sentinel lymph node biopsy done and it's negative on both sides, the false negative predictive value, or the likelihood that you missed a positive node, was 1.7%. Overall, we feel like this data has validated the whole concept of sentinel lymph node biopsy alone in patients with high-risk endometrial cancer, and we feel like it's time to change our current algorithm for treatment.